Hello and welcome to a brand new episode of The Daily Debate. My name is Ahmed Nader and tonight we'll be focusing on the presidential initiatives to be eliminating the waiting lists over the past 2 or 3 years, according to the directives of His Excellency President Abdel Fattah al-Sisi, to be developing the healthcare system in general in Egypt in the past few years. And I'm honored to be having with me over the program for tonight Dr. As-Saeed Abdel Hadi, the president of Horace University and the former dean of the Faculty of Medicine at Mansoura University. Thank you very much for being with us tonight on the Daily Debate.
Thank you, sir, for having me, and very good night for you.
Anytime. First of all, we'll be starting straight away with the top story from the African Union and the participation of Foreign Minister Sameh Shoukry on behalf of His Excellency President Abdel Fattah al-Sisi. As the African Union wraps up the 36th annual summit in Addis Ababa, Foreign Minister Sameh Shoukry delivered a speech before the gathering on behalf of President Abdel Fattah al-Sisi. In his word, Shoukry said that the conflicting parties in Africa ought to stick to the African solutions for the crises in the continent. The minister said that the remarks during the session was held to discuss the report on the activities of the African Union Peace and Security Council. Spokesman of the Foreign Ministry, Ambassador Ahmed Abu Zaid, said that the Foreign Minister Sameh Shoukry started the speech with a reference to the fact that the African Summit is held this year in the international and the regional critical circumstances, which require more cooperation in the face of the current security challenges. Shoukry also put stress on the priorities of the African joint work to secure achieving security and peace for the countries of the continent, including unifying efforts to contain the conflicts spots in Africa. Dr. As-Saeed, first of all, how do you see the importance of strengthening the bilateral ties between Egypt and Africa in general?
Yeah, I think this is of paramount importance, of very significant to strengthen our ties with all African nations in all fronts, not only the political one, but also the development, the conflict in the era of nationwide conflicts like conflict in other parts of the world, and to take part in elevating the quality of life and the standards of all African nations. I would say Egypt has a great role and also a great responsibility to help our African neighbors, because we are in the heart of Africa.
Yes.
All our ties, we don't forget that the Nile, which we live on, comes from the center of Africa, including 10 nations. Not only that, but have very strong economic relationship with almost all the 52 or 50 or more countries in here. I would say even in the field of medicine, in the field of education, last year we had the Medical African Summit in June. I think we came across that in one of your episodes.
Yes.
And that all parties, especially the physicians and administrators in the field of medicine, were called into Cairo. I think there's another summit this year. So building ties, correlations, cooperation, and also strengthening the relationship with all African nations, I think is of utmost importance for us and for the Africans.
Foreign Minister Sameh Shoukry also mentioned during his speech the current circumstances that the world is going through. Of course, the conflict between Ukraine and Russia. Before that was the COVID-19 pandemic. How do you see the importance of strengthening ties between Egypt and our neighbors in general in Africa, in the Arab world, and in the Mediterranean region as well, according to those circumstances?
Yeah, absolutely. As the minister said, the world is busy now. There are conflicts everywhere, especially between Russia and Ukraine, that swallows most of Europe. Also, the Americans are interested. So there is less interest in our region now. Yes. And it is our duty to solve our problems and to cooperate with other neighbors. I don't think that anybody will give hand to Africa except the Africans. And Egypt plays a pivotal role in that one. Usually, when I was abroad, they used to say, why are you leaving Africa behind? You have a role to play, because only three countries in this, I think, can play a role: Egypt, South Africa, and Nigeria. These three countries can play a significant role to build up and raise the standard and quality of care for the Africans. On all fronts, I would say: the political agenda, the conflict zones, we can help. And of course, we are all living and in Egypt, looking forward for a peaceful solution to our conflict with Ethiopia regarding the Renaissance Dam or the Ethiopian Dam. And we are hoping, or full of hope, that we will come together for building for the future, for the prosperity and welfare of everybody, not at the cost of anybody. So we live and help others to live in a good standard.
Yes. And finally, Doctor, regarding this topic, you mentioned Egypt, South Africa and Nigeria as three of the biggest African countries, especially in the terms of economy and the financial strength for those countries. Do you think that the economic coordination between all of Africa, including Egypt, South Africa and Nigeria, could be giving us the upper hand in terms of regaining peace and security within Africa, as you mentioned, African solutions for the African problems?
Absolutely. Again, these three countries, because they are the most populous, but also the largest economies and the most advanced scientifically, I would say. So they have a lot to do. And almost all of the political disputes or wars, to be frank, comes as a consequence of the economic shortings. So if we build a cooperation based for win-win game, benefit for all, so we can benefit the Africans and also we can get benefit from the Africans. We have a lot to do and a lot to give, and also we can take many things from them. And that's true for all the crops, for our agriculturals, for the meat, we can, instead of getting our needs from far away, it's better to get it from Sudan, from Ethiopia, even from South Africa and Nigeria, and also to give our products of medicine. We are now having a good manufacturing of all medication that we can give. A lot of things could do, and a lot of ties, a lot of benefits, a lot, as I said, win-win game we can build on that.
Yes, speaking of the economy and the importance of the economy and money, more specifically, we'll be heading to the main topic of the daily debate for tonight and the first report of the episode for tonight. About 17 billion Egyptian pounds were allocated to be eliminating the waiting list for the patients, according to the presidential initiative and the directives made by His Excellency President Abdel Fattah al-Sisi in the past 2 or 3 years, ever since the year 2020. We'll be having more details on this topic in the upcoming report.
The Ministry of Health has announced that the state has spent £17 million on the presidential initiative to eliminate waiting lists so far, as the health budget has increased over the past years by more than 300%. The Ministry of Health spokesman said that what has been spent on the health systems is £60 billion, and more than 60% of the size of hospitals in the Ministry of Health has been established, and £30 billion have been spent on health system for university hospitals for maintenance and renewal. The total operations that were carried out amounted to 1,576,700, and then start from July 2013 until now, and 84,064 citizens benefited from orthopedic surgery, and 67,000 citizens performed open heart operations, and 500,000 citizens carried cardiac operations. through the initiative to eliminate waiting lists without the citizen incurring any financial costs. These numbers have a direct indication about upgrading the health system in addition to 1.5 million citizens who benefited from surgical interventions without incurring any expense. The waiting list rate decreased from 1.5 years and 2 years to 3 or 4 weeks. President Abdel Fattah el-Sisi in less than 2 months approved 2 initiatives to develop health care centers, increase the number of working hours and the presence of specialized clinics, the mental health initiative and the provision of psychological support, and before that the liver and lung tumors initiative. And the President's interest and support for public health did not stop. The goal is to improve the life of the Egyptian citizen in light of the approach adopted by the President, which is a decent life for citizens.
Welcome back. You're still watching the Daily Debate. Dr. Saeed Abdelhadi, how do you see the importance of the presidential initiative to be eliminating the waiting list for the patients?
Yeah, indeed there has been many initiatives, but that one in particular, eliminating the waiting list, has been very significant.
Yes.
If we go through the history, the very recent history in the last 5 years, was started 100 million health initiative that eliminated virus C, is a major health problem, in the year 2018. In the next year, another presidential initiative for cutting short and at the time eliminating the waiting list for the major surgeries and major problems that are very costly indeed. The majority of the Egyptian citizens who suffer that one, in particular in fields like cardiothoracic surgery or catheter interventions cardiac diseases, joints replacements, spine surgery and neurosurgery, as well as organ transplantation, liver, kidney, cochlea. These are very expensive. I would say in Mansoura, by the way, Mansoura came second for the participation in eliminating that, and only after Ain Shams, of course, Ain Shams. And then Mansoura, and the third was Cairo University. That was based on the major teaching hospitals within Egypt, as well as the major teaching hospital within the Ministry of Health, like Mahad Nasser, Mahad Al-Alb, and so on. Total, we have made over 1,500,000 and around 500,000 and 600 citizens have done major surgery. So very close to 1.6 million major surgeries.
In about 2 or 3 years.
Yeah, in about 2 or 3. And it's still continuing because, as we say, we start for cutting short and then to eliminate, there are new cases building up. So it is a never-ending story. You will say that I'm going to end all patients with bedridden because of disc prolapse or because of valve replacement in the heart or because of replacement of hip joint or knee joint, because there is another.
It happens every day.
It happens every day for a new cohort of patients. So it's ongoing. But I would just say that in our experience in Mansoura, because we have programs for liver, kidney, and cochlear transplant, and also bone marrow transplant.
Yes.
We were very short of supporting, economic support for these patients, and we used to get from the insurance and from the donations and things like that. But the rate was limited by the financial support. Now, with this initiative, we are used to do 2 liver transplant every week. We are used to do 2 kidney transplant or more every single week.
Yes.
We used to do so many hip replacements. So pushing money into this has changed the life of the average Egyptians. I would say 1.6 million means 1.6 million families, not persons.
Yes.
So especially if the father or the mother in the family are suffering this disease. So that was an initiative that really improved the standard and improved the quality of life for, as I said, 1.6 million families of the Egypt. A year later, we started what's called the Comprehensive Health Insurance Initiative, and that's going to extend with us till 2032, and that would be the mega project in health which Egypt really needs.
The insurance system, as you mentioned, did it reach Mansoura?
No.
The Qahliya?
No, not
yet.
Not
but
yet.
it started in Port Said and
Yeah,
Sinai.
we started in Port Said, 1920, and extended to Ismailia, to Suez, I mean the Canal One, Sinai, some part, and Luxor.
How do you rate the success of the insurance system in those governorates as a start?
Oh, very good. That's a building up, you know, it's called a cumulative experience, a cumulative increase in facilities.
Yes.
Everyone who think that overnight you're going to say, I'm going to start in the Qahliya, which is 7 million, or in Sharqiya, 70 million, or in Greater Cairo. By the way, Greater Cairo is coming at the end because these are about 30 million kind of thing.
Yes.
But the Qahliya in the fourth phase, so expecting in 3-4 years. Anyhow, starting the comprehensive health insurance will take 50 years, I would say, to become an established, because you will need also to reform health as you go, because it's not a system in one governorate. It is a reform that you will need a system based on the general practitioner, so have to build that one. You will need physicians qualified to provide the what's called family medicine, and then you will have the transfer system. Within that one, there is a lot of things coming together. So there will be financial aspects, there will be scientific aspects, technological aspects, because you can't build modern kind of thing without a very strong telecommunication and digitalization system. So it's not only building primary health care and hospitals and referral systems, but digitalization, training nurses, training GPs is a full system. But I think Egypt needs, and the Egyptian citizen needs, to live in some form of security against the disease, and that's only offered by the comprehensive health insurance system.
Speaking of the comprehensive health insurance system and the elimination of the waiting lists as well, what are the facilities or the facilitations that were provided by the government, provided by the funds, the responsible funds, for the citizens in terms of measures to be facilitating undergoing the operations in the past couple of years?
Oh, it's very good. That's really a story to tell, because there are 3 sectors within the comprehensive health insurance system.
Yes.
One sector is for finance, which is very important, and there is a responsibility for every family to pay certain part, about 5, maximally 7% of its income, to cover its participation in that. So it's part on the person. Those who are under the limit, which cannot participate at all, the government will. The government will cover everyone who cannot pay its participations, around 5%.
Directly from the Ministry of Health or the Ministry of Higher Education, or from the Tahya Masr Fund or Long Live Egypt?
Along a big list of kind of things, but from the budget of the Ministry of Health, from the donations kind of thing, from tax as well. And in the last episode, it was from the World Bank. We got some also money to build the facilities needed. So there is one aspect, finance. The other aspect is the healthcare provider, that is the Ministry of Health, and also at the primary level and second level, but the tertiary level, that's the Ministry of Higher Education. And we can't speak because the reform will include, this system will put a very strong tie between the Ministry of Health and the Ministry of Higher Education, I mean the teaching hospitals, because these will be responsible for the tertiary care. So cutting or eliminating the waiting list will be mainly through the teaching hospital, which are the reservoir or the tanks for the very experienced physicians who can undergo these interventions. But again, back, the majority should be 70 to 80% provided by the Minister of Health. And this will come again to the need for the physicians and nurses and dentists and the pharmacists and all this kind of thing. So this is another sector for the provider. First, we spoke about the finance sector, which, by the way, is headed by the Minister of Finance. The health sector or the provider is headed by the Ministry of Health. And there is a quality kind of thing which observes the action of physicians and maintains the quality of nursing. So the planning was very good, I would say. Yes. Our experience of the 5-year experience of the health insurance is really good. And as I said, just kick off, as you know, and the kick off will lead to more experience. So things which happened in Port Said over a year can now happen in Luxor over a month, and will happen in different parts in a shorter time, because we learn from our experiences, and that's the value of starting. And as I said, the comprehensive health insurance system will solve all the problems of health we are speaking about. So physicians will find a suitable place to work, okay?
Yes.
And that's...
with good salaries.
Absolutely.
Yes.
With very secure, in a secure and safe environment. And also, there is no direct relationship between the physician and the patient. So the physician will be doing only medicine. The patient will pay to the government in the form of certain sector, as I said, 5 to 7% of income. And also the quality will observe kind of thing. So that environment will make the profession a safe and secure for every physician, and also for every patient to have the needed treatment at the needed time without cost.
Yes, doctor, you mentioned that about 1.5 million operations or surgeries have been conducted in the past 2 or 3 years. With what is the average cost of every operation, and what is the most popular type of disease that is being conducted over?
Absolutely, that's a very good question. I will say it in Egyptian pounds, and it's equivalent if you go to Europe or even in China.
Yes.
In Mansoura, we charge for liver transplant. That is a very lengthy operation and very skillful technique.
That's the specialty of Mansoura University.
Yeah, we are #1 now, and thanks to the team. 2 days ago, we celebrated the 1,000th successful liver transplant from live donor, which is a record, phenomenal record, by not only by national but by the international standards. We are #1.
Yes.
And hopefully we are now giving a hand to another centers in nearby governorates to build up. Thanks for our funders and Professor Muhammad Abdul Wahab, who, by the way, is now the chairman of the International Society for Liver Disease. But the cost for that one is 250,000 Egyptian pounds.
Per operation.
Per person, including the operation itself and the follow-up for life of the patient. The least cost for this operation in Russia is $500,000, and up to $1 million in America and Europe. So you can now compare the cost of what we do with the cost if a single person has decided to go abroad. So even we are 1/10 of the cost, and the success rate is exactly the same. And
why don't we be attracting people from all over the world who want to be getting a liver transplant into Mansoura?
Yeah, that is the next step, because let's need another episode.
It's like therapeutic tourism.
What is we now doing in Mansoura liver transplant for the whole Arab countries, but at the Egyptian rate, because these are, we think this is part of the duty of Egypt to help our brothers and sisters in Arab.
So it is popular at the Gulf, for example, for the Arab countries?
I can get you, I can post you the data, but we do liver transplant for Yemenis, for Libyans, for Iraqis, for Sudanese, exactly as per the Egyptian, and we don't charge them. But we have decided that ethically they should be, the donated liver should be one of the family till the first certain degree of relationship after the fourth. So if we have to expand this, we have to legalize the transport, the liver transplant from the cadaver after death.
Yes.
In this case, you would offer it to anywhere. But now we are just limiting it to the live donor, and we're limiting it to a relationship till the fourth degree. So if you have to have a liver transplant anywhere in Egypt, you have to bring the donor, and this donor should be related to Scott blood relationship. But we have a chance, and I think we're working on it now, but the law has to state that they have to approve transplant from cadaver, from people or who died recently, and this will another system. We can make that one in the liver, in the kidney, but I would say there are organs which are only possible to transplant from the dead, recently dead, like the heart, like the lungs, like the intestine. Okay,
Yes.
we can take this from a live person. So if we manage to overcome our disputes and legalize that, Egypt would be a very successful center because we have the expertise. As I said, in one center we have had 1,000 successful liver transplant from the donor. By the way, the liver transplant from the cadaver, from the recently, is much easier because the dead wouldn't suffer if you take the liver in a good way or in bad way. But for a live donor, you must be careful for taking care of the live one. So we still have a long way to go through that one. But I would say Egypt has an excellent chance for we call not only in the organ transplant, but in all specialized surgical skills. If we can market it in a good way and have paved the way for anyone who can come as a tourist to have, in addition, not to see the pyramids, but to have surgery.
Does it need more advertising like we see for other countries like China, for example, to be traveling, to be seeing the country and getting surgeries and operations at the same time?
We need a lot to do. I would say I have visited India one time, and I'm fascinated with what the Indians have done. They have managed to attract the doctors to come back. And these are the physicians who are doing surgery in UK and in USA.
The Indian doctors.
Yeah, Indian doctors to come back. They have built hospitals state of the art, and they've got accreditation from GCI, or the Joint Commission International, which gives the highest level of certification to the center. So you got the physicians and the place.
Yes.
They have made it easy for anyone from the whole world to come to India by just online visa. So you just go in
To be getting treatment.
to get treatment, to get visa into India. Online visa, you can get it within 30 minutes, you know. Not only that, they have built hotels very next to the hospitals. So state-of-the-art hospital, state-of-the-art hotel. So the family can come with you, they stay in the hotel, patient goes to the hospital. They have good translators who speak Arabic, English, French, Russian, Chinese. So they have made it, and a telecommunication kind
It's like
of thing.
attracting investments from the outside
Absolutely. And the irony is that the money pushed for that was mostly from the Gulf states as well. So, but we have to take a model, you know, as I said, that would be a real source of income. India makes $80 billion a year from tourism, health tourism. And you need to see, we speak about 7-8 billion from Suez Canal, or 10 million from the Egyptians abroad, or whatever. 80 million goes into the
And also, Doctor, you mentioned a very important point that His Excellency President Abdel Fattah al-Sisi spoke of before, that a lot of the doctors who are recently graduated, they tend to be traveling to other countries,
absolutely.
especially because you mentioned India and Pakistan. They work for the United Kingdom, for example. They travel and they work and they get paid what they want. And you mentioned a very important tactic, to be bringing them back. So there is hope for us in Egypt to be bringing the Egyptian doctors if we have the facilities needed.
There is a story I can tell in that one. I was in the UK around the year 2000
Yes.
when 5 of the top administration in India, including the personal advisor to the Prime Minister at the time, including the Minister of Health and Education and Social Solidarity, all of kind of thing. They came with one objective, to get the very skillful Indians back to India. And they kept asking, if we came to India, what's it going to do? You will get 70% of your income in the UK, but you will be part of the administration and you will get paid much more than you were in the UK. So that's one aspect. The other thing is you will live in your country, you will serve your people, you will make life better for each one. So we can do. Egypt start to do, but we are not very clever in doing that in the way that Indians and Russians in particular have done it. But we can make a lot of benefit from giving strong and committed from the head of the state, and I think the president has said several hundred times that we need to get every Egyptian who can help to build Egypt. And that is the
because we have
mission.
the potential, we have the capabilities.
We have everything. We have everything. Egyptians, Mr. Ahmed, I can bet you, there is not a single hospital in the UK now that doesn't have Egyptians in every specialty. You are speaking about junior doctors. Now we graduate doctors to work in the UK. More than 5,000 doctors have left Egypt over the last 2 years to the UK only, adding to Germany, to the US, even to Australia and New Zealand. There are Egyptian doctors everywhere. That's good, and it means that the Egyptian doctors are gold standard. They are very good.
For the education of us.
Absolutely, and
That's
that answers the next question about, we always complain of the standards and universities and things like that. But look, what is the outcome of these? These graduates from the Egyptian universities are now working in every corner of the globe. More interesting, we are now have graduates from Egyptian universities who are working in Malaysia and Russia, everywhere. Wherever you go, you will find Egyptians who qualify.
Success and experience, that's
and
what we want.
Not only Egyptians, but there are natives from other countries who are graduated and trained in Egypt in particular.
If we turn to the amount of funding that we have had here in Egypt, about 17 billion Egyptian pounds funded for the elimination of the waiting list, just for this field in terms of healthcare. How do you see the amount of money pumped into the healthcare system of Egypt over the past 7 or 8 years under the tenure of His Excellency President Sisi?
I would say that would be a very huge sum of money. I would tell my experience as the Dean of the Medical School in Mansoura, in the year 2018, the budget for only one teaching hospital of Mansoura was £3 billion. For just one. We have now over 110 of these teaching hospitals. So if you multiply this even by that half of this figure, so we speak about at least £100 billion. At least each single year. So the irony is that now, which was I used to spend in the year 2018, is now doubled or tripled. So at that time, the cost of a hip replacement was 50,000, now it became 150,000. The cost of open cardiac surgery was 50,000, now it should be 100,000. Because most of the equipments that we use are imported, and that's another item. The devaluation of the pound has made it very difficult for the supplies to come at the rate and the speed that we needed, because the cost has increased significantly, at least doubled.
Yes, Doctor, we'll be heading to the second report of the daily debate for tonight, and it comes from the presidential directives of His Excellency President Abdel Fattah al-Sisi to be developing the healthcare system in general in the country. We'll be having more details in the upcoming report, so stay tuned.
President Fattah al-Sisi is keen on following up efforts to improve the healthcare system in Egypt, as Egypt is working hard to improve health services in line with the 2030 Sustainable Development Goals. The Egyptian government attaches due importance to the comprehensive health insurance system covering all social segments and to complete the implementation of the health insurance system, which was launched by President Fattah al-Sisi in 2018. In a meeting with President al-Sisi, Minister of Health and Population Dr. Khaled Abdel Ghaffar offered an overview of the state's health map. This included the number of government and private medical facilities ties, their medical equipment, medical staff, as well as linking the health map to the database of Presidential Initiative 100 Million Health and its health and medical care programs and initiatives for citizens. The meeting also tackled the upgrading of Nasser Institute as part of efforts to turn it into a global medical city. President Sisi gave directives to establish the largest regional center for organ transplantation in Egypt, the Middle East and Africa in this new medical city, in cooperation with major international specialized companies. This aims to establish an integrated system which includes an automated database of organ transplantation patients and donors. Abdel Ghaffar also reviewed details of the establishment of the new al-Masriyin hospital with a capacity of 400 beds. The hospital will provide its services to about 3 million people and is considered the main hospital to receive road accident victims in Giza Governorate and its suburbs. The President directed to speed up the implementation of the financial incentives package for medical staff, as well as evening clinics in hospitals, and to allocate a percentage of the return to doctors and medical staff. The Minister of Health also briefed the meeting on the achievements of the presidential initiative to end waiting lists over the past 4 years since its launch. He said 466 public and private hospitals participated in the initiative. The President gave directives to provide additional financial resources to expand the initiative and add new surgical specialties. He underlined the need to raise citizens' awareness on how to benefit from this initiative and to simplify the relevant administrative procedure. The importance of boosting health systems in African countries is by developing comprehensive strategies to ensure medical supplies and equipment, in addition to constructing health facilities that meet international high-quality standards.
Welcome back. You're still watching the Daily Debate. Dr. Saeed Abdelhadi, as we did speak about the elimination of the waiting list in terms of operations and urgent surgeries for the Egyptians, I would like to speak about or ask about the cooperation that we have witnessed between the Ministries of Health and the Ministry of Education or Higher Education as well under the tenure of Dr. Khaled Abdel Ghaffar. How did you see that he changed up things during his tenure?
Oh yeah, thank you for opening this discussion, because indeed we have a window of opportunity to achieve what we have been dreamed of over the last 50 years or so. Now we have the Minister of Health, Professor Khaled Abdel Ghaffar, and he used to be the Minister of Higher Education, and he has made a very successful agenda for increasing the number of universities to close to 70 or more, by adding much more national universities, national international universities, has brought international universities in here, has increased the number of teaching hospitals, and have made really very successful agenda during his era as a Minister of Education, of Higher Education. Now his deputy, Professor Ashur, has taken the post as a Minister of Higher Education, and Professor Abdel Ghaffar has become the Minister of Health. I think with these very strong men cooperating together, we can solve the whole problems we have been rammed between the Ministry of Higher Education and the Ministry of Health. I would say there has been sustained progress in each corner within the Ministry of Health hospitals all over Egypt in the last 5 years or so. I have seen hospitals brand new opened everywhere in every city, and that's very good.
Yes.
Have to build on, because there should be collaboration between these two men to bring forward a very successful teaching hospitals for the need only of those who need tertiary surgery or tertiary intervention. And the secondary should be for the Ministry of Health. But we don't undermine the value of very successful tertiary centers within the Ministry of Health itself. As I said before, Ma'had Nasser, Ma'had Al-Qalb. But also in the last few years, we have seen in El Khanka or in Calliopeia, the city for manufacturing drugs, and now we see Nasser City for healthcare service. So we can make now the reform we have been looking forward for so many times. Also, I would say there is another important to improve the legalization, and now we're going to see activity for the Egyptian Council, our General Health Council for Egypt, which will regulate the process. So the relation between the physician and the patient, as well as a one system where all the doctors are qualified and trained according to the standard, whether you are in a teaching hospital or in a Ministry of Health. I think if we lose this opportunity, it will never come back, because the man who used to run the Ministry of Education is now running the Ministry of Health. Both men are fully aware of the challenges and the reform needed, and I think we started. We still need, to be honest, the regulation or the law to regulate the relation between the patients and the physician, what's called the Medical Responsibility Act, is now on the waiting for discussion in the House in the Parliament. The collaboration between the primary, secondary, and tertiary, primary and secondary, fall in the domain of the Ministry of Health. Tertiary falls in the Ministry mainly of Higher Education. We need to get collaboration and integration between these two. I would say I'm very optimistic, and there is a window of opportunity. I would ask all parties to come together to make the reform for training of physicians, for as well distribution of physicians.
Yes.
And the most important, we don't need, everywhere in the world you'll see, if you take 100% of the graduates, 40 will go into the family or the GP. In Egypt, it's only 2 or 3%. So we need to expand. We need to make the reform in all France. Most significantly, we need the General Health Council. Is led now by a very experienced Professor Mohammed Lutaif as well, who used to be the head of the Universities Council before. Anyhow, we have very experienced, responsible dignitaries who can work right now. We can sit together, we'll get the regulations done, we'll get the reform done, and I'm pretty sure the future will be much better for every person in this country, either he's a physician or a dentist or a pharmacist or a physiotherapist or a nurse and also a patient.
Yes, one of the more important statements made by His Excellency President Abdel Fattah al-Sisi and Prime Minister Mustafa Madbouli in the past year or so is that the investment, the foreign direct investment, has to be made by the government hand in hand with the
Private
public sector
yeah.
and the private sector.
Very
How do you see the importance of pumping the investment through all three parties at the same time in the healthcare system of Egypt?
Yeah, by the way, that was the talk of the Minister of Higher Education 3 days ago. He said one of his main initiatives is the public-private partnership. The public is the responsibility of the government to produce according to the available budget, but the private sector can do a lot, 70% of people can be employed by the private sector. Also, the private sector can push the money that can make the difference. And now, in the UK, the country which initiated the NHS, they send people to be trained and operated upon in India and also in Egypt, I would say. We have in certain hospitals in Egypt that come from UK to have the surgery done here. That's not a joke. It is really happening.
Is it cheaper or with a higher quality?
Because they assure that the standard of the facility and the physician is as it is in the UK. And this is, as we told, the Indian experience. But we can do that in Egypt now. Coming back, the public-private partnership can solve a lot of problems for that one. And even if you have this service in the private sector, the government or the health insurance can pay for it. So this collaboration, also the speed that the private sector expand and spend money is much easier than the government. Anyhow, that's one of the initiatives that the Minister of Higher Education spoke about, and I am pretty sure is going to happen. And the future is very optimistic, to be honest. And I think we have a lot of very fortunate things happening all together. We have very good graduates, and speaking about the medical field.
Yes.
We have facilities in the private sector. We have regulations that's going on to improve that one. We have collaboration between the heads of this domain. And I have seen, if you can see in the report, there are very, very elegant personnel around the ministers, like the Prime Minister and the counselor or the advisor for Professor Muhammad Awad Tagiddi. I can see there are think tanks in the field of health who can make the difference. And I think it is the time to do it. And we have the facilities and the expertise and also the fund that we can deliver.
Yes, Dr. As-Saeed Abdelhadi, the president of Horus University and the former dean of the Faculty of Medicine at Mansoura University. Thank you very much for being with us tonight on the Daily Debate.
Thank you so much.
Anytime. And this brings us to the end of the Daily Debate for tonight. I will be leaving you, however, with the latest presidential activities in the past week in the upcoming report. Thank you for watching and goodbye.
President Abdel Fattah el-Sisi participates in the high-level Al-Quds conference, which is held at the Arab League headquarters in Cairo. The conference is also attended by the Palestinian President Mahmoud Abbas and the King of the Hashemite Kingdom of Jordan, His Majesty King Abdullah II bin Al-Hussein, as well as Secretary General of the Arab League and co-chair of the conference, Mr. Ahmed Abul-Ghait, and a number of high-level delegations from Arab League member states. President Abdel Fattah el-Sisi arrives in the United Arab Emirates capital Abu Dhabi to participate in the World Government Summit. The president is received by the President of the United Arab Emirates and ruler of Abu Dhabi, His Highness Sheikh Mohammed bin Zayed Al Nahyan. The two leaders hold a meeting at the Presidential Palace in Abu Dhabi. President Abdel Fattah el-Sisi congratulates Mr. Christodoulidis on his election as the new president of Cyprus. President Abdel Fattah el-Sisi meets with the UAE Vice President, Prime Minister and ruler of Dubai, His Highness Sheikh Mohammed bin Rashid. In Dubai, President Abdel Fattah el-Sisi meets with the Managing Director of the International Monetary Fund, Ms. Kristalina Georgieva. President Abdel Fattah el-Sisi participates in a roundtable on billionaire startups at the World Government Summit in Dubai. It was also attended by officials from major billionaire startups in technology applications, artificial intelligence, e-commerce, and sustainable resource management. President Abdel Fattah el-Sisi participates in a session on empowering the private sector and the role of the Sovereign Fund of Egypt, which is held on the sidelines of the World Government Summit in Dubai. The session is attended by representatives of a number of the largest family-owned companies. President Abdel Fattah el-Sisi participates in the World Government Summit in Dubai. President Abdel Fattah el-Sisi meets with the chairman of the Islamic Development Bank Group, Dr. Mohammed Sulaiman Al-Jasser, in Dubai. President Abdel Fattah el-Sisi meets with the Prime Minister of Tunisia, Mrs. Najla Boudin, in Dubai. President Abdel Fattah el-Sisi receives Kenya's Cabinet Secretary for Trade, Investment and Industry, Mr. Moses Kuria, who hands in a letter to President el-Sisi from the President of Kenya, William Ruto. President Abdel Fattah el-Sisi participates via video conference in the 40th session of the NEPAD Heads of State and Government Orientation Committee. The session is attended by African heads of state and government, as well as members of the committee. During the session, Egypt takes over the chairmanship of the AIDA-NEPAD Heads of State and Government Orientation Committee from the President of Rwanda, Paul Kagame. President Abdel Fattah el-Sisi congratulates in a phone call the Cyprus new President Nikos Christodoulidis for winning the presidential elections. The president is briefed on the efforts to produce and supply strategic agricultural crops as he directed the provision of the highest levels of support to the agricultural sector and farmers and the continued developing of contractual farming systems to encourage the expansion of the cultivation of strategic crops.